Today we're talking about alternative, complementary, and functional medicine, and roundtable discussion amongst our members and anyone that's here on the internet that would like on the internet, but on 20 meters that would like to participate. Again, it's a Zoom simulcast. So if you're on 20 meters, I do want you to be able to use the resources that we have available on our website. I've published the background material with all the links. If you would go to healthcarehams.org and go onto our main page and look under posts, you'll find a PDF that contains all the internet links to the information that we're using as a background. And we're having that roundtable discussion about the subject. But I would assume that most healthcare providers of traditional healthcare have had patients come in having used other approaches not prescribed for care and asking about the use of such or looking into not those that are looking into non-traditional answers for healthcare related issues either. And we'll talk about what alternative, complementary, and functional medicine is, and at least the descriptions I was able to find probably varies what it means from person to person. We tried to find some standards to go by. It's an overview of the topics. This today is not really a scientific evaluation, certainly not medical advice, but if you're participating today and you'd like to suggest one of the areas we talk about having to become a Grand Rounds on the Air subject where scientific studies are available, please contact me, JAA4FL, at my QRZ email address. And realize that there are even college level programs for study in the field. One I see often when I'm driving, and I'm not suggesting this, but at least it's advertised on billboards and such, and on internet links is Everglades University in Boca Raton, Florida. Don't really know much about the program other than the fact that it is advertised in various ways. So, what's the traditional healthcare system? Well, Western medicine, also known as allopathic or conventional medicine, is a traditional healthcare system primarily practiced in the USA and many other parts of the world. And in the Western world, you may also hear it described as mainstream medicine. It involves medical doctors and healthcare professionals treating symptoms and diseases using scientifically tested drugs, surgical procedures, and other advanced medical technologies. The approach emphasizes evidence-based practices and scientific research, making it the dominant medical system in regions like North America, Europe, and Australia. And that definition comes from the Cleveland Clinic. If you'd like to read the entire page about it, there's a link on that post that we have of the notes. Also, there's integrative medicine, which is this is going to be from the NIH, this description, the National Institutes of Health. It combines conventional and complementary approaches in a coordinated way, emphasizing evidence-based practices from both fields, focusing on multimodal interventions, which may include conventional treatments like medication, alongside complementary therapies such as acupuncture, yoga. In contrast, complementary medicine is used alongside mainstream medical care to enhance treatment outcomes, such as using acupuncture to alleviate side effects from cancer treatment. Overall, integrative medicine encompasses a broader approach that includes complementary medicine, complementary therapies as part of comprehensive treatment plan. That's from the National Institutes of Health. And again, the links to that material, greater material, are on our website, healthcarehams.org. I encourage you to go to the post section of our main page. Just scroll down a little bit in the right column, and you will find that information. Now, Chip N5RTF is with us. So, Chip, as a psychiatrist, before we get into all these particular details, can you comment on the need for patients to request alternative care and their involvement in making decisions about their care, even when it may depart from traditional healthcare systems? I assume that you've yourself had patients through the years that have mentioned using alternative therapies as well. Turn the mic over to N5RTF. This is Whiskey Bravo 5 Delta.
Yeah, this is N5RTF. One of the chief principles of medical ethics is patients, respect for the patient's autonomy. So if a patient is strongly desires a particular kind of treatment, um, and you don't know that it's specifically harmful, you have a pretty strong responsibility to let them try something. Now, if you know it to be harmful, then you have to speak up. Um, and you certainly don't have to prescribe something just because a patient requests it. But there's a fine line there, and most of the time you can go along with a patient's desires if the range of treatments, say there's 5 different ways to treat a particular illness, and one that the patient strongly prefers, and there's no real evidence that any of them is better than another one, then you should always go with the patient's desires. Also, there's a lot of I guess it would be self-hypnosis involved, and if somebody believes, they strongly believe that something is going to help them, there's a strong placebo effect, um, and then that can make a difference in whether a patient gets well or not. That can feed back to the immune system, strengthen it, and fight off illness through the patient's own bodily defenses. And again, that's the belief in a particular drug or procedure or just lifestyle is a positive factor in the person's life. Okay, and 5-RTF.
Okay, thank you, Chip. N5-RTF. This is Whiskey Bravo 5 Delta. We appreciate that description. I'm going to pause here, not just for ID, Whiskey Bravo 5 Delta, but if you're listening on 20 meters, and the home call here is AA4FL, located in Hawthorne, Florida. So you would benefit from turning your directional antennas towards Florida. And I'll pause one for additional check-ins. Do we have additional check-ins on 20 meters? Make your call. Okay, I have KE0PIE in Colorado. Trina, thank you for being here with us. Any additional 20-meter check-ins? KD5QHV in El Paso. Thank you for joining us here today, Bernie, as well. Any additional check-ins? Okay, for those of you that are watching on a YouTube video or on our Zoom, we know that everyone is aware of what amateur radio is. But if you're watching a YouTube video production of our net here, you realize that amateur radio is a very vibrant hobby. And this is a net, or a group of amateur radio operators that meet on the air to discuss a passion, a personal passion, which is pretty common in amateur radio. And our particular passion is healthcare related subjects. So we're not giving medical advice. It's just a roundtable discussion amongst our members, talking about our individual takes on a particular topic and how it interests us. And, we're very fortunate to have members from different fields within medicine. So I'm going to ask a few of our participants here to discuss their take from personal standpoint before we actually get in to defining or talking about what alternative medicine is, or functional medicine, or we'll do definitions as well. But we do have individuals that belong to our group that are involved here that have had medical training in different parts of the world. And let's hear how conventional traditional medicine, Western medicine, was taught. Jerry, N4TSC, you're here with us today. I believe you went to medical school in France and did your advanced training in ophthalmology in South Africa, if I remember correctly. In your medical education, how do you think it differed in terms of these alternative complementary approaches? Let me turn the mic over to N4TSC. This is Whiskey Bravo 5 Delta. Go ahead, Jerry. Go ahead and unmute, Jerry.
Yeah, I think I've got it unmuted now. Just a couple of things that I should tell you. You started to talk about amateur radio and what its interest is. Just the other day, 2 days ago, a neighbor, we stopped to talk, and he asked me about what kind of an antenna system I have, and we got into chatting, and turns out he, in a rather late stage in life, is now interested in getting into amateur radio. So I gave him a book on amateur radio for dummies. So we're going to get started with that. As far as education is concerned, I actually trained in the US in ophthalmology, but I felt that I didn't have enough experience doing actual surgery. So I happened to meet someone from South Africa who said, you got to go to South Africa. You're going to learn how to do cases, and you'll do 5 to 10 cases a day. Spend a year there and you'll really learn how to do surgery, which was then the state of the art, even in South Africa. And so I went there just to enhance my experience doing surgery. And he described the table that we used and the chair as the Captain Kirk chair, because it had all the controls in a special chair in which you had foot controls, in which you could control exactly what you were doing from your foot pedals. And that was a great experience. So I also got a chance to meet people who were there from other places, like Wales, someone who had left Russia and had come from Russia to learn. And I found that there was a difference in the amount of experience and the um, development of the cases. The person that came from Russia had a very limited knowledge of ophthalmology when he came. The person from Wales came because she wanted to pass certain exams that they have in the UK and Wales, and wanted to be able to pass those exams. And there was another fellow from the US who came for the same reason. In fact, several people from the US had come there to get more experience learning how to do surgery. One of the problems that we actually had in the States was you didn't get enough cases to be able to feel that you had a comfort level to be able to do the surgery. And so we all had our reasons for being there, but we all went there for the same thing, to enhance the experience that we had. So I found that was a great difference between what we had exposed then in the US. And I think that also what I'm experiencing now is, because of Zoom, I'm able to join grand rounds from Baskin Palmer, which is considered the most prominent uh, educational area in ophthalmology in the United States. If it's not one, it's one of the best. And I'm impressed with the quality of the students that are there. So I think it depends on the institution you go in, the experience that you have, and that makes a great deal of difference in how you perceive and how you have a comfort level for the surgery and the experience that you have and the knowledge that you have.
Okay, thank you, N4TSC. So, Jerry, that's ophthalmology, and I guess that's, there's not really a lot of alternative treatments that patients are going to ask for. But when did you go to medical school in France? And if you did, can you contrast what the approach in education when it came to non-traditional treatments? Did you get exposed to any of that in medical school?
No, I didn't get any exposure to that in medical school, and I find that the background and the experience that we had in France prepared us in a particular way. And I think there's a certain kind of equivalence in education in certain countries. But I think that in the United States, we're sort of paranoid about thinking that we're the best and we're the only country that can deliver education. So we had a system called the ECFMG, in which we had to qualify in order to be able to practice in the US. And as far as complementary medicine is concerned, I've kind of been thinking about this particular subject area, and I'm interested in knowing what others have to say. And I thought of this as kind of a brainstorming subject to learn about it, because my first knowledge of it was by someone who I think was in California, who started to talk about complementary medicine. Didn't hear much about it until I happened to be at the Pri-Med continuing medical education course in Miami last year, and one of the subjects was complementary medicine, in which there was a presentation about it. And so I've sort of had my interest in that area. I think the fact that you mentioned hypnosis, I'm interested in that. I was interested in that even as a kid, trying to learn about it. Never got any formal knowledge about it other than what I was able to pick up myself. And I wonder about what its basis is. But one of the things that I learned anecdotally is that there have been elements of the use of complementary medicine. And in one case, anecdotally, there's a story about Buddy Hackett, who you may or may not remember as a comedian, who on occasion, he had such stage fright that he was unable to be able to perform, and he had to cancel certain performances he had. Now, this is not something that you would think if you've ever seen him perform. However, it turns out that he used to try to calm his nerves for his stage fright by drinking, and then he developed, probably by talking to physicians, he developed the approach of trying to calm his nerves by doing breathing techniques that were reported in the Pri-Med education course that I had last year. And it turns out that there is some basis for it because, as you know, there is the orthosympathetic system, which is the fight or flight response that you have. And then there's the parasympathetic system, which kind of is the reverse of that. And you are able to stimulate your parasympathetic system by doing certain kind of breathing techniques. Now, they talked about a system of something called 3-7-4, in which you hold you breathe in slowly for 3 seconds, you hold your breath for 4 seconds, and then you breathe out slowly through your mouth for 7 seconds, and then repeat that. And that tends to stimulate your parasympathetic system. And that's a way of using complementary medicine rather than what he had been doing before, which was drinking in order to calm his nerves. And so that was the first association that I kind of put together after having heard the explanation of it in the course that I took last year. And I just am so much interested in it that I just wondered whether there are others that have an experience dealing with this on a more formal basis. And I do understand that there are now some medical schools that are beginning to give courses with a view toward developing knowledge about complementary medicine and how it may work.
Thank you. That was N4TSC with Whiskey Bravo 5 Delta. As we talk about complementary medicine, at least a definition that we found through the NIH would be if a non-mainstream approach is used together with conventional medicine, it's considered to be complementary. So the question, Jerry, also, as you said, medical education is changing. So when something is mainstream, does that change over time? So can a non-mainstream approach become a mainstream approach? So when those of us that went to school in the 1970s and 80s or the 60s, in our professional educations, what was considered to be non-mainstream then would be mainstream now. An example in dental school, where we went to school with the medical students, back in those days, chiropractic medicine was actually looked down upon, whereas now it's pretty mainstream. So things can change over time, and we'll certainly talk more and hear from other individuals here today as well about that subject material. Why don't we step back for a second and just talk about some of these other issues? So integrative medicine combines conventional and complementary approaches, the NIH definition, in a coordinated way, emphasizing evidence-based practices from both fields. It focuses on multimodal interactions, which may include conventional treatments, and I think we've talked about this, alongside complementary therapies such as acupuncture and yoga. So we've talked about this earlier today, and we're going to talk and develop that thought process more, and then hear from those of you. I know that we have Stuart, WA9ZPL, who is very much in tune to continuing education, and I'm sure he'll have some input. And we have other members like Andy Smith, WJB, who practiced medicine for years and could probably give us some good input on what patients requested. So before we do that, let's go back and just see, where the descriptions fit in. Talking about chiropractic medicine and even massage therapy, which is starting to get kind of mainstream these days. But when is it? When is it mainstream? I mean, I guess it depends. In traditional medicine, it probably varies from practitioner to practitioner in their approach and what they claim to cure. I mean, if somebody's claiming cures for things that are not considered to be scientifically based, then they can actually deviate from traditional treatment. So traditional medicine, according to Copilot, an AI definition, it refers to the knowledge, skills, and practices rooted in the cultural beliefs of various societies used for maintaining health and treating illnesses. Well, again, that talks about different cultures, and that's going to vary from culture to culture. So when we talk about Western medicine, we're more referring to the U.S. and Australia and Western Europe. But the definition of overview encompasses a wide array of practices. So it could be considered in some areas of the world to include herbal medicine, acupuncture, spiritual therapies, which are based upon theories, beliefs, and experiences indigenous to different cultures. So that would be more integrative here or complementary here. And it's often passed down through generations and maintains a primary source of healthcare for people worldwide, especially in regions where access to conventional medical services is limited. And that's a definition from the World Health Organization. But the historical context can also be seen in our document. If you'd like to go read more about global usage and historical context, go to the healthcarehams.org website and look at the posts. And the document has all the links in that, including the practices and systems that are used in different parts of the world, descriptions on spiritual health and challenges, considerations, and whether or not traditional medicine, being a vital aspect of healthcare for many cultures, offers a holistic approach to health and well-being that's deeply rooted in historical practices and beliefs. And in some areas, what we call traditional medicine may not be available to those individuals. I'm going to pause one here for ID. This is Whiskey Bravo 5 Delta, and this is Grand Rounds on the Air Net for amateur radio operators on 20 meters. All amateurs are encouraged to participate. We're having a roundtable discussion amongst our members and guests. We have a passion for health-related subjects. That being known, and this is AA4FL at the mic in Hawthorne, Florida. Do we have any additional stations that would like to check in? Make your call at this time. Okay, no additional check-ins at this time. But alternative medicine would be any range medical therapies are not regularly considered orthodox by the medical profession. Things like herbalism, homeopathy, acupuncture. And if you go to the NIH link that I provided in our document, if a non-mainstream approach is used in place of conventional medicine, it's considered alternative. So that's when it's not used in an integrative way. But complementary medicine is the non-mainstream approach used together with conventional medicine. That's called complementary. Functional medicine, according to the NIH, is a term sometimes referred to a concept similar to integrative health, but it may also refer to an approach that more closely resembles naturopathy, which is a medical system that evolved from a combination of traditional practices and healthcare approaches popular in Europe during the 19th century. You'll see the term holistic medicine. This is a definition from WebMD, a form of healing that considers the whole person, body, mind, spirit, and emotions, in a quest for optimal health and wellness. According to a holistic medicine philosophy, you can achieve the best possible health by gaining proper balance in life. And I know as a dentist, I often use a holistic approach, looking at the individual as a whole, because I'm not treating their tooth, I'm treating the person itself, and more information about that as well. Before we get into the Eastern medicine and look at all the different aspects of that, in Japanese medicine, Chinese medicine, for example, let's hear from some of our practitioners that are here with us. Stuart, WA9ZPL, if you would discuss what some of the current topics you've run into for non-traditional medicine that you've, seen in some of the online courses or continuing education that you've participated in. We turn the mic over to WA9ZPL. This is Whiskey Bravo 5 Delta.
Well, there are a lot of people with a lot of opinions, but there seems to be a consensus that folks who go to an allopathic, traditional MD provider, such as I was, that probably 40% of them are simultaneously using some form of supplements or complementary medicine, one of the other things that you just mentioned, Jay. And a lot of the time, they don't disclose that. Sometimes they choose not to disclose it. Sometimes it's simply because they haven't been asked. And sometimes the duration of the visit is insufficient for that to be disclosed. But that's a must, because sometimes something being taken as a complementary or supplement item could badly interact with something else that the patient is going to get at the doctor's office, or that the patient is going to get in the hospital. So you got to maybe take the time. That's the first point I'd like to make. Second point I'd like to make is that when new students start traditional medical schools, they come with their own background. A lot of the people on their first day of medical school are already taking some supplements or some complementary medicine stuff. There are also new medical students who may have a family member who's in this arena. They may have, for example, a family member who, like maybe their father was a chiropractor, would be one example. So they have their own agenda, and they may or may not be willing to disclose that to the medical school faculty. So medical school faculty have to be sensitive to this as well. Sometimes where the rubber meets the road is when students have to have their mandatory immunizations before they could start medical school, or before they could start seeing patients in the hospital. And some of the students might come into medical school with their own vaccine hesitancy. And it goes on from there, because these are the same students that are going to have to talk to their future patients about immunizations. Back over to you, Jay.
Yeah, thank you, Stuart. WA9ZPL, Whiskey Bravo 5 Delta, AA4F Alpha Mike for the Grand Round there, Net here for ID. Thank you for your service as a faculty member and training medical students. Now, you were in geriatrics, is that correct, Stuart?
I did both geriatric medicine and general internal medicine.
As someone who's practiced geriatric medicine, I'd imagine with polypharmacy, that's also as you get older, you're taking more and more medications, more chances for interactions. And not that everybody has cognitive decline, but for those they may be very sensitive to suggestions from all sorts of sources and not able to make a determination. So did you see that in your geriatric population? WA9ZPL, Whiskey Bravo 5 Delta.
Oh, yeah. People would commonly come in with a dozen prescription medications, plus who knows how many supplements. I was on another conference during the past week with the eye echo for geriatric medicine, where this point came up, and they quoted another geriatrician where a student asks the geriatrician that the patient has a dozen prescription medications. We think they might be having side effect, and what should be the first medicine to be discontinued. And the geriatrician supposedly answered to say, just pick one at random. You'll never be able to reason it out.
Okay, thank you for that input. I guess that can be pretty risky depending upon what they're taking, and that's part of this transition or maturation and getting the continuing education for those that have gone to school years prior, which weren't exposed to it. That's what continuing education is all about, and that is a requirement. So hopefully that's an area of study practitioners are pursuing. Andy, WJAB, I believe you practiced internal medicine. Please correct me if I'm wrong. And can you tell us a little bit about your practice? And did individuals come in looking for suggestions on non-traditional therapies? And did they ask for your advice? And how common and what other considerations can you think of, Andy? WJ8B, Whiskey Bravo 5 Delta.
Okay, well, I was a general internist, and for the first 2/3 of my entire medical career, I also had a fairly good sized hospital practice. During most of that time, I had a fairly large nursing home practice as well. So that pretty much describes what I did for quite a while. Retired in 2018. Um, People did bring that up frequently. There were a number of physicians in the local Columbus area who practiced, even though they had a medical DO or MD degree, were practicing essentially um, using supplements and alternative treatments. So I periodically would run into patients who had been to them and either were no longer satisfied or wanted to see both. Okay. And then we had to try to figure out when they're on several different medicines, which ones could be a problem and which ones, they could continue. In some cases, throw up our hands and had them just stop everything. That wasn't, that was safe, at least on the alternative side. I also had experience explaining this to family members as well. I had family members. I only had one brother, but my wife's family, she's a second of 12, and frequently have conversations with her siblings over that. One of the ones that constantly came up was something called Sam E. And there were two or three of them that were just as convinced that that was curing all their problems as anything. And it was a belief almost. So it's really hard to contraindicate that. But then again, you have to look and see if there's adverse effects reported from any of the allopathic or alternative medicines as well. Because if there's nothing and it's not hurting them, doesn't even necessarily hurt them other than their pocketbook to take them. So that's all I have for now. Back to you, Jay, WJP.
Okay, thank you, Andy. WJ8B, Whiskey Bravo 5 Delta, AA4F Alpha Mike from Hawthorne, Florida, for identification purposes. We have some contributions here that have come in through chat. And N3IM was an emergency room physician, now retired. Also mentioned that there used to be, Keith mentioned, there used to be schools of homeopathy, some of which have turned to conventional medicine. And he's in an area of a lot of Amish, and the Amish are believers in alternative medicine. So those of you that are in areas, you're going to see a difference based upon your geographic location. Do we have any? We've had some nice discussion here from two of our member physicians Stuart, WA9ZPL, and Andy, WJ8B. On 20 meters here, do we have any questions of them from those on the air? Make your call to Whiskey Bravo 5 Delta, and we'll start a list for questions. Do we have any other questions coming on the Zoom side on our simulcast of our two doctors? Go ahead.
I wonder if anybody's had any experience directly with acupuncture and or hypnosis as an adjunct to normal medical care.
That was a question from M4TSC. We're going to be talking about acupuncture in just a minute, at least in terms of what it is, and then we can address that question, Jerry, afterwards. Any other questions on the Zoom side? Okay, this is AA4FL at the mic. We're operating as WB5D, our club call, the Medical Amateur Radio Council. So we're also known as Healthcare Hams, and you can go to our healthcarehams.org website. And when you do, on the main entry page, look on the right column, scroll down, and you'll see posts. And on those posts, you'll be able to get the link to the actual document here that has the links within. And you'll be able to look at some of the things we couldn't go over all this, it would take forever. And actually, this is just an introductory overview of the subject in general. And if our members find a particular aspect of this to be worthy of a true scientific evaluation and discussion, we'll field that. And hopefully you'll be part in that research effort. But we talk about Eastern medicine or traditional Chinese medicine. The Cleveland Clinic has a nice page that talks about the root of traditional Chinese medicine, is the concept of qi, translated in the English language as the energy, power of force that travels through the body in order to give vitality to every cell and throughout the body through pathways called meridians. So I would imagine that most health providers have had patients that come in that are believers in qi. And then, as Jerry mentioned, we're talking about acupuncture and traditional therapy, non-traditional therapies, or it might be traditional if you're in China, the insertion of thin, sterile, disposable metal needles into your skin to relieve symptoms of disease and restore balance to body functions. And according to the document here, that's from the Cleveland Clinic, the benefits are varied, but what is most well known in the US is treating conditions of pain. And more doctors and surgeons than ever are referring their patients for acupuncture therapies to treat pain. And Jerry had also, mentioned perhaps hypnosis or biofeedback therapies, which are other therapies. So, are there individuals here on 20 meters that would like to talk about acupuncture and also biofeedback therapies and hypnosis? Make your call and let us know. Okay, on our Zoom simulcast, do we have any input answering Jerry's query? Make your call. Okay, Jerry, we're not having any input right now from those that are participating. I will mention that there was a root canal specialist that I knew who's now deceased, way ahead of his time. He went undergraduate in Syracuse. I'm not sure where he went to dental school, but he practiced acupuncture as a root canal specialist, not acupuncture, hypnosis as a root canal specialist. And he would hypnotize his patients, and he would state that he would get very good results from that. I can't remember if he avoided anesthesia with his hypnotizing, but perhaps he did. So he's not around anymore to ask. Do we have any other practitioners with us today that would like to comment on that? Make your call.
N5RT.
Okay, Chip, N5RT. I'm going to turn the mic over to you.
Yeah, I've never used hypnosis myself. I've definitely seen it used and know several people that used it routinely in their practices. One of the interesting things about the brain is that it, like every other organ, it can be modified physically, let's say by surgery. It can be modified chemically by drugs, but it can also be programmed. You can't really have a discussion with your liver, but you can through a variety of techniques actually rewire your software in your brain to believe certain things or behave in certain ways. And hypnosis is a good example of that. People question, why does it even exist? Why can you even do that? And there's been several books written on that have some really strange um, ideas going back historically. But I looked it up. There are over 500 different types of psychotherapy, and they all work to some degree, some better than others for certain conditions, certain people. But they all pretty much boil down to the relationship with the practitioner. If the person believes in the person who's treating them, they're going to respond to almost anything that you use. You can a simple form of hypnosis. I'll give an example. Is when I was working as a general practitioner, I would occasionally have to do procedures on a child. I would have to deaden a laceration to sew it up or something, and I would find that if you just give them something to hold in their other hand and concentrate on it, sometimes an ice cube. They would focus on that, and you could do almost anything to the other arm, and they wouldn't even feel it. It's very interesting, to see that kind of stuff in practice, but it's real, and it has more to do with whether the patient believes in you than anything else that's happening. N5RTF.
Okay, thank you very much, Chip. Appreciate that valuable input. That was N5RTF from New Orleans here at the microphone. This is AA4FL at the microphone from Hawthorne, Florida. Now, Chip, in dentistry, we used to use that distraction technique for giving injections. You would tug on the lip, pinch on the lip at the same time, and in less of a formal way because you weren't instructing them, you're just distracting them. Children, it was always very helpful to ask them questions, engage them, and ask them about their dog, and it relaxed them, quite a bit what pets they had, and then, go ahead and proceed. And I'm sure as physicians, many of you have used that technique. Andy, with seniors, does the theory of distraction have a place in your practice? WJB, Whiskey Bravo 5 Delta.
Well, it was fairly common for us to do that just for simple phlebotomy. I saw several different things done that way. Fortunately, I only had to do that earlier in my career. Most of the time, I had other personnel to do that, but the one who worked for me for 30 some years used to just snap her fingernail against the arm right before she gave the shot, and virtually no one complained about getting shots from her. And it was a very simple thing. It's not like she was causing intense pain, but it was a distraction, and it did seem to work. So, and I did know of other phlebotomists and nurses that use similar techniques with some success.
Thank you, Andy. As a dentist, one other approach I used, and it's not commonly used, but the dental equipment is most often transthorax, so it's over the patient's chest. I used rear delivery systems where everything was behind the patient's head to help relax them from the pain, at least eliminate the sight component. And on children, you would cover their eyes during an injection also and talk them as part of that distraction and ask them about their animals at the same time. So there's lots of ways to sort of distract from pain. Into the Eastern medicine, the Chinese medicine approach, as we went through the qi and and in the brief discussion. And as you go and read that document more online through the links that are on the healthcarehams.org website, I mean, there's other aspects they talk about, the Chinese herbal medicine that's been used for eons, and also things like Tai Chi. And we talk about yoga and, Tai Chi and ways to relax ourselves and have meditation or meditation in motion. And people use TM as well for meditation. So there's all types of Eastern philosophies that can be used. And as far as what the science says, is modern medicine doesn't necessarily show definitive evidence of qi in the meridians, which are said to flow, but traditional Chinese medicine's popularity has remained consistent throughout the centuries for improving health and wellness, used alongside conventional medical therapies. And modern medicine shines when it comes to implementing crisis intervention and disease management. We should be thankful for emergency departments, operating room burn units, trauma and care facilities, and life-saving pharmaceuticals. But at the same time, the traditional Chinese medicine could be a valuable complement to modern medicine, recommended by medical professionals who value its emphasis on promoting health, balance, and wellness in those for whatever reason it's effective, whether it's scientifically based or it's getting the brain to believe, as our psychiatrist Chip and 5-RTF mentioned. I had a patient that was into Reiki healing, Reiki, a Japanese approach, an ancient Japanese healing practice, considered a form of energy healing. It stems from the Japanese rei, or meaning universal, and ki, meaning vital life force energy. So the theory is that a master of that therapy, when trained in that, can channel the universal life force energy to you. And they say they do this by either lightly placing their hands on you, by hovering them just above, using a series of hand positions. And some people will call these techniques centering, clearing, beaming, soothing the aura. And the Reiki masters say they don't create energy or give energy to you, rather they act as a conduit for universal life force. So it's, certainly deviates from our traditional medicine. I have seen that in my particular practice one time. The person was very much into non-traditional therapies for some pretty serious infections too, as well. And I think probably relied on it a little too much, rather than integrating it to regular medicine, traditional medicine. What about herbal therapy? I mean, for centuries, Chinese and Asian countries embraced herbal therapy, and now the West is catching on to the timeliness of this ancient medicine and started to incorporate Chinese herbs and treatments for a wide range of health concerns. There's a Cleveland Clinic article about that, where it's discussed and what Chinese herbalism is. I suggest if you want to read more about that, go ahead to the links on the document on our entry page for healthcarehams.org. Now, we use traditional formulas that consist of a few herbs that have strictly designated roles according to them to address the primary complaint. But as Andy mentioned earlier, we have to be careful because people are on a lot of different medications and herbs can interact. So wouldn't it be nice if physicians have that knowledge or continuing education to, especially if they're in an area where a lot of these non-traditional approaches are used, to know how they work and the benefits, but also the risks for such, and making sure that they're safe. We did receive a book in the mail from a physician who sent us a book on vitamins and minerals. And this particular book, he's linking this, and let me read exactly what the book says and the name of the book, and I'll leave it to you as to whether or not you want to try to read that particular book. We can find that here. It's called Vitamins and Minerals: The Forgotten and Hidden Facts of Them by Dr. Tootie, Dottore Tootie, MD. Not to endorse what he's writing, but he states it's the basis of functional medicine, alternative medicine, and complementary medicine. So this particular book goes into an expanded details about vitamin therapy. Now, certainly you can see from an NIH perspective, their take on minerals and vitamins as dietary supplements. And there's a consumer fact sheet on the NIH. That link is again in our document, where you can just search for the NIH.gov fact sheet on vitamins and minerals, and I'm sure you can find that as well as the same for fact sheets on dietary supplements for the consumer. And it was defined what a dietary supplement by Congress in the Dietary Supplement Health and Education Act of 1994. What a dietary supplement is: a product other than tobacco that's intended to supplement the diet, contains one or more ingredients, including vitamins, minerals, herbs, or other botanicals, amino acids, and other substance or their constituents intended to be taken uh, by mouth as a pill, capsule, tablet, or liquid, and labeled on the front panel as being a dietary supplement. So, in addition to the information that the NIH has in the fact sheets, Dr. Tootie has gone through and tried to describe every particular mineral and vitamin and what they're used for and what some of the stated benefits might be in the alternative functional medicine world and complementary world. So, not to endorse his thoughts, but it certainly could be an interesting read for those of you that are interested in that particular subject. And it is quite a large book. I did not get through all of it. One of the big crazes amongst my wife's friends, including nurses, is the use of magnesium supplements. So I quickly looked at the magnesium section. But as you see, things become faddish in popular culture, and it would be within different groups of individuals, not uniformly endorsed. I mean, look what happened during COVID. All the people that were using certain concoctions that were made at home, trying to avoid getting COVID. Any comments about that from the group? Make your call to AA4FL WB5D if you'd like to comment on that. Well, yeah, once again, Andy, WJ8B, did you want to comment on that? Go ahead.
Yeah, part of the issue in this book probably tried to approach it is that many of these things have not been studied, probably most of them, and you don't have real scientific data that's verifiable. I mean, we have double-blind studies for most of our major new pharmaceuticals, and they go through that. It takes sometimes years with huge expense to finish those studies before the drug can be released. None of that ever happens with these alternative therapies, vitamins, minerals, or whatever. So that is a problem. Sounds like this book at least was looking at that, but it still doesn't really give you, solid scientific data.
Thank you, WJ8B. A good point, Andy. I'd imagine that, it's true of dosages. NIH certainly tells you what they think the recommended doses should be. And then, a particular book might tell you something more, or your friends may tell you more in their interpretation. Some of them might be within healthcare, and not being that there's not necessarily the scientific studies that the drug industry does. But when you're looking at herbs, wouldn't, Andy, you think that uniformity would also be an issue? I mean, just because you have an herb doesn't mean from one area to another that it's got the same content. So, you could study the variability. Any comment about that?
Well, I think
Well,
that's
Okay, Stuart, WA9ZPL, would you like to start with that first?
take the example of spinach. People know from childhood Popeye cartoons that spinach contains iron, but do they realize that the amount of iron in spinach depends on the amount of iron in the soil where the spinach was grown?
Okay, thank you for that input. WA9ZPL in Illinois and Chicagoland. And we have Andy in the Columbus, Ohio area with us, WJ8B. Andy, some comment?
Yeah, well, I agree with what Stuart said, and that applies to, lots of these vitamins and herbal treatments because, the dosage is probably not standardized in many cases. Um, and there's different manufacturers that don't necessarily make them or package them in the same way, so that definitely becomes an issue.
Okay, so the question that I have then, Andy, is so the drug industry is looking at these different herbs and looking at the active components or researching them from nature. So am I correct in saying that those are scientifically studied, but the origins could actually be coming from herbs or contain other aspects of vitamins in their particular treatments? Would that be a correct assumption that that's scientifically studied? Stuart, WA9ZPL, comment?
Well, you're absolutely right, but there's another point. With modern analytic techniques, DNA, you'll sometimes find that the supplement fails to contain the ingredient that's on the label. And the screw up could be anywhere in the supply chain. Also, you may find that the supplement contains other ingredients that aren't supposed to be there at all. For example, ibuprofen has been found in various supplements when it is not supposed to be there.
Okay, thank you, WA9ZPL. When you mention genetics and susceptibility to individual genetic profiles, do you think sometime in the future that individuals, genetic material will be able to be looked at and predicted which therapies might actually benefit them where they wouldn't for others? Or
Well, that's certainly true, but it's also true for side effects. For example, allopurinol, the commonly used prescription medicine for gout. We now know that there is a genetic trait that hugely increases the risk of a potentially fatal side effect, TEN, toxic epidermal necrolysis. And you can do a simple blood draw to determine if a patient has this gene before you give them the prescription for allopurinol.
thank you, WA9ZPL. So, guys, in being a dentist, of course, I'm no expert on cancer treatments, but I thought I remember reading that with children particularly, because the therapeutic index is such an issue with a smaller body weight there, that it was extremely important whenever possible to actually test these medications, these cancer treatments, the chemotherapies, to make sure that particular person is susceptible to get the dosage. Because why would you use a chemotherapy on somebody that it wouldn't work? I imagine that impact would also be true on seniors. I mean, tumor boards seem to just go by statistics. How well does the overall population this medication work for them? But that's not necessarily true for individual. Is that a correct statement there, Stuart? WA9ZPL, Whiskey Bravo 5 Delta.
It's correct, but there's a whole nother level that needs to be mentioned. It's becoming common now to sequence the DNA of the cancer cells. And by looking at the genetic makeup of the tumor, you can get a really good clue whether a particular treatment is going to do any good.
Yeah, I guess there's modifiers. A lot of us ham radio operators here at 20 meters are getting to be, older in our 60s, 70s, and 80s. And one thing I can think of might be prostate cancer. So there's certain therapies that are affected by things like, and please correct me if I'm not stating this accurately, by testosterone levels. And testosterone reducing medications are given to make the therapies more effective for those individuals. Is that based upon the cells themselves, or is that a statistical based suggestion, Stuart? W9ZPL, Whiskey Bravo 5 Delta.
Well, the first observation of this was, I think, around 1952, when diethylstilbestrol was administered for treatment of prostate cancer, and the drop in testosterone seems to have resulted in a temporary remission in a number of patients. Back then, they didn't thoroughly understand what was happening, but nevertheless, a Nobel Prize was given for this discovery.
Yeah, I think in my generation, growing up, being born in the 1950s, it was a common situation to have a DES baby, and there were also unwanted outcomes from that, from what I remember. Andy, WJ8B, would you like to comment on these particular subject threads we've been discussing? Go ahead and take the mic, Andy, WJ8B.
Okay, well, it's very interesting talking about the genetic things that are attributed or have to be looked at for treatments. You know, I was aware of that going on in cancer, uh, particularly the hematologic cancers. That's been done for a long time, but it's now being done in other cancers as well, which does direct therapy, and it's very interesting. Very good thing that they've been able to figure that out.
Okay, thank you, Andy. Maybe we're drifting a little bit away from our core subject material from today, but again, go to the document on our website, healthcarehams.org. We're going to make a YouTube video out of today as well, so the general public will have the benefits of learning about amateur radio and the types of discussions that are held on amateur radio, and another vibrant part of our hobby on today being alternative, complementary, and functional medicine. So it takes a village, and we're glad that constantly we're reevaluating our treatment therapies and improving them. They modify over time. What's traditional one year may not be traditional in the next generation of medical education or medical practice. And if you're a patient and you're on 20 meters here listening, or you're listening on YouTube to our video that we make here, you might have questions to discuss with your health professional. If they don't know the answers, ask your health professionals where they would suggest that you find out the answers, because at the end of the day, it's you and your medical professionals that help you to supervise your care and treat your care for whatever medical conditions you have. Thank you for being here with us today. Do we have any further questions on 20 meters before we bring our net to a close? Okay, just before we get off, in therapies, in the past we talked about Manuka honey, KN0S in Vietnam, and used when he was in Vietnam. They used that a lot in wound care. I actually saw that in Walmart the other day. So now they actually have that particular honey, and we talked about therapies and the sources of those therapies coming out of New Zealand. They consider that particular honey to be therapeutic for burns, whereas honey in general may not, because you have to look at the source has been discussed earlier today, of where these herbs come from and supplements come from. They're products of their environment. That being said, we'll bring this discussion to a close, and we appreciate everybody that was here today. We haven't picked our subject for next week. Grand Round is in the air, but we will have one. Thank you for everybody that's joined us today, and we look forward to having further discussions. Use our healthcarehams.org site for looking up additional information about the Medical Amateur Radio Council. Thank you for being here with us today. This is AA4FL for Whiskey Bravo 5 Delta. Late ID here, been identifying throughout, and bringing our Grand Rounds in the Air session to a close. 7-3.
Comment